Dr. Susan McGrew from the Vanderbilt Treatment and Research Institute for Autism Spectrum Disorders. I've specialized in autism for the last 11 years. I went into the field at a time when there were very few people in the field and have really grown along with the field. Autism is a neurobiologic developmental disorder. It probably starts in utero well prior to birth, although the symptoms don't show up until usually after the age of 1. The developmental disorder consists of 3 parts: a language disorder, a social disorder, and a restricted repertoire of activities and interests. Well, actually, some of the earliest videos on children can show some differences in children with autism. I've gone back and reviewed videotapes of children down to a year of age at birthday parties, and they'll see differences in their eye contact and their social reciprocity with their parents. Some of the earliest symptoms you'll see is that children just don't respond when they're talked to. And a lot of parents will tell me they thought their child was deaf because they would say their name and they simply wouldn't respond to them, but they would jump if there was a sound around. Those are probably the first things that get picked up are the language disorders, but the social disorder, if you are looking for it, is quite obvious also at that age. Well, we refer a lot to autism spectrum disorders because, especially with earlier diagnosis, sometimes it's hard to be certain which part of the spectrum they're on. And by spectrum meaning that there are they're just higher and lower functioning and different areas that are stronger and weaker in people with the autism spectrum disorders. Asperger's disorder it was the most recently recognized of these disorders, and it is a higher functioning version of the autism spectrum disorder. Those children have normal language, although they may not use it normally. They have normal IQs or near normal IQs, but they have a lot of social deficits, and that's their primary area of problem, or their social deficits in the restricted repertoires of activities and interests. So when you first meet them, they really appear like anybody else because they talk normally. Children with classic autism have deficits in all 3 of the areas. They do have language deficits, social deficits, and restricted repertoires of activities and interests. And these can be very severe, where a child is just not making any eye contact and just waving his hands and spinning all the time. Or it can still be a high-functioning child who is making some eye contact but doesn't make it normally, looks from the side, goes for hugs from behind, will talk but doesn't use pragmatics normally. So there's still a gamut within the autism, classic autism, and there's also a range of intelligence within the classic autism, but they do have deficits in all 3 of the major areas. And children with pervasive developmental disorder have deficits in either 2 or 3 of the areas, but they are not as broad of a deficit. Well, practically speaking, not very much difference. I think people get hung up on the semantics too much. Technically speaking, to diagnose Asperger's, there cannot be a history of a clinically significant language disorder. So if a child presented with a language disorder that then normalized as they got older, they might look like an Asperger's when they're older, but they're technically not supposed to be categorized that way. Nevertheless, they may function very much like somebody with Asperger's, with normal language but a lot of social deficits. Yes, I do have an opinion. I think there's a very strong genetic component to autism. We can trace it in families, but it's very clear that it's not a single gene, and it's multiple genes involved. And because of that, the genetic picture has been so complicated. We have not been able to get the specific genes all identified, which is why people have searched for other causes. Now, it's my personal belief, and I am probably in a minority of physicians that believe this way, but it's my personal belief that genetics don't account for all of the autism. Now, certainly there are some environmental insults that we know can cause autism, such as some of the premature births, some certain viral infections when a baby's in utero, but I believe there may be some other environmental causes that we have not yet identified. When people first started noticing that autism was increasing and they had never recognized that vaccines had increased, people started wondering, were the increase in vaccines associated? Was that a causal association? And I think that was a good question to ask. I think it's been asked, and I think it's been studied very carefully scientifically, and there is no scientific evidence that the increase in autism is related to vaccines at all. The initial evidence with the MMR vaccine was discredited. That was not done properly scientifically, and that has all been discredited. The questions about the mercury in the thimerosal in the vaccines has also been studied very carefully now, and that is not, nobody when they first studied it even knew how much mercury the kids were getting, but that's actually been very carefully looked at now, and there is not any association with that cumulative dosage of thimerosal, which is now removed from the vaccines, and autism. A lot of people have still been very struck with that idea because of the increase in autism has paralleled the increase in vaccines. But an association doesn't mean there's a cause, and at this point we have no evidence for cause. I will say we have a lot of evidence that there is no cause. Let me reframe that. They removed thimerosal from the vaccines in 2001, and there were a few vaccines that still had it around, but not very many. By and large, the thimerosal exposure disappeared then, and autism has not disappeared or even decreased. I do feel that at least part of the increase is explained by better diagnosis. We have refined and standardized the diagnosis is better. They have developed very standardized ways of testing the children, realizing that we don't have any blood tests for autism. So we have to rely on psychological testing, and until we really standardize psychological testing, there was going to be a variety of ways that people could be diagnosed. Not that they would be diagnosed with a problem, but they might or might not be diagnosed with autism. They might be diagnosed with something else previously. We've really standardized that a lot. So now people using these standardized psychological instruments are coming up with a good deal of agreement on people with autism. And that has really expanded the number of people diagnosed with autism. It is my personal opinion again, and a lot of people do not agree with me on this, that we're actually seeing more autism than was around 20 years ago when I first went into pediatrics. The epidemiologists, when you talk to them, feel that they can explain the increase based on changing diagnostic criteria and better diagnostic instruments. I don't believe that explains the entire 20-fold rise that we've seen in autism. That is something that I personally don't believe. So I would have to go back and wonder again, is there some environmental component that we have not identified yet? I think, obviously, I want to start an intervention as early as possible, and we're limited somewhat because children are not diagnosed that young. So we can't start intervention before the age of 1. Nobody's diagnosed really before the age of 18 months. I think as soon as there is a diagnosis, there's a lot of good evidence that early intervention, particularly with language therapy, is effective at helping to improve the outcomes in autism. Now, there isn't any evidence that I know of that says that any of the early interventions cure autism. It's a lifelong disorder, but they do improve the outcomes. We do have many more children becoming verbal than were 20 years ago. So I think that's really important. Language therapy is a really important and key part of that, establishing functional communication, but that's not the only therapy that is useful in autism. There are occupational therapy, which can help children with some of the sensory issues that are associated with autism. There are other additional therapies, including behavioral therapy, which often gets, I don't want to say ignored, it does not get as much attention as it should get. Really teaching children appropriate responses. Children with autism don't necessarily pick up based on your facial expression whether something was appropriate or inappropriate, but they can be taught. They can be taught how to read those clues, or they can just simply be taught what's an appropriate response and what isn't. And I think that that is a very integral part of the necessary therapy. Best practices in autism, we'll say about 25 hours a week of a mixture of therapies is what's really recommended for early intervention. That can be including some developmental preschool programs, some language therapy, some ABA therapy, some occupational therapy. On medication, on prescribed medication, there is no medication which affects the core symptoms of autism: the language deficit, the social deficit, the restricted repertoire of activities and interests. You can make some amount of difference in the self-stimulatory behaviors, which is kind of a core deficit, but not very much. So we really do not, anybody that is promoting medication to cure autism, to cure those core symptoms, it's just not true. That's not going to happen. And I think that that's a disappointment. I wish we did have a medication that would cure autism, but we don't. We don't even have a medication that will cure one part of autism. Medication is really used for symptoms that go along with autism. And some children with autism have additional behavioral or psychiatric symptoms that do require medication. Those can be any symptoms from aggression, self-injurious behavior, attention deficit disorder symptoms, anxiety disorder symptoms, obsessive compulsive symptoms. There are a variety of those symptoms, and they do appear to occur more frequently in children with autism than they do in other children. So if those particular target symptoms are there, then a specific medicine to address those symptoms can be useful. And there's certainly some scientific data that actually shows better outcomes, particularly for the medication risperidone, which has probably been the best studied one in autism. As far as the alternative therapy, the complementary and alternative therapies, they're complementary and alternative therapies because they have not been studied standardly. If they had been, they would have moved out of that realm. So we do not have a lot of good scientific data on the complementary and alternative therapies. And new ones come along all the time, and they do come along and get promoted with testimonials, but without the scientific data. I think it's really important, because there are so many of those therapies going along, for people to stop, do some research. First of all, do research to are these things safe? Second of all, what am I trying to do with this, and how am I going to assess, does it make a difference? Because there isn't any scientific data out there to tell you what will make a difference. I think a lot of people can end up looking for one after another of those that will promote a cure for autism. I haven't personally seen that in any, I've seen testimonials, but of the people I've seen, and I have over 800 patients with autism now, and I don't discourage anybody from doing any of those treatments if they should choose to do so. I don't encourage them either, but I don't discourage them. But I do ask them to keep me informed of what they're doing. I don't personally, to my eye, see any difference in the core symptoms of autism in the kids that are on those treatments when they go on them. Now, sometimes with diets, some of those kids with gastrointestinal issues do seem to show some improvements in their gastrointestinal issues and in their behavior when they go on the diet. But I have found that's usually children that are having gastrointestinal problems, and some special diets may help for that. Well, I think the advantage of having a BCBA is that there is a certain level of training that they have had. It is required in order to get the BCBA. I've certainly known many people that did not have a formal BCBA that are perfectly able and willing to do behavioral therapy with children with autism. So I wouldn't want to ever imply that behavioral therapists without that can't do the work. But I do think it is an additional measure of control there, of parents being able to know that there is a certain level of quality and training that the person has had. I think it's most important that you interview the person and make sure the personalities and the type of behavioral therapy being proposed mesh for your child if you are selecting a behavioral therapist. And by that I mean that some behavioral therapists will target a specific goal that may or may not be what is a particular interest of your child. And I think it's really important to find one that finds someone that you can develop a collaborative plan for. These are the things that I want to work on. Most of my approach with behavioral therapy has been with positive behavioral therapy rather than with negative behavioral therapy, and that's what I recommend with the children with autism. Well, I usually do refer them to the Autism Society of Middle Tennessee, and I do, and to the websites for the National Autism Association. I think that there's a lot of good information out there. The American Academy of Pediatrics puts out a lot of good information. The first thing I like to tell people is this isn't a race. You don't have to rush out and get everything started at once. Take a little bit of time to look to see what fits with your lifestyle, with your insurance, and with what your particular child needs. It's not a one-size-fits-all type of an approach. Every child needs a different type of program, and I think they should be individualized really more. Not that I want to delay getting therapy started, but I really don't want people to feel like they have to get therapy started so quickly that they don't have time to investigate really what they want to do. You'll be doing this a long time. It's good to have people that you are comfortable with working with your child. I do try to get the language therapy in particular started as quickly as possible, because the earlier that starts, the better that seems to go. I also really do encourage people to meet up with some of the other parents and to talk to them about different resources and just some levels of support. There are periodically, the Autism Society of Middle Tennessee will hold different parent education seminars, and I think that can be very useful. The most important thing I think I tell a parent when their child is first diagnosed is this is still your child. This is still a human being, and you don't need to make your child somebody different. You want to help your child be the most functional person that they can be. And I think people go through a grieving process at first when there's a diagnosis. But I think you need to move on from that and recognize this is your child and you love your child and you're going to help them be the most functional person they can be.
Well, I've been practicing traditional medicine for a long time, about 15 years. But I have a daughter on the spectrum. Stella was born 12 years ago, and as it became obvious when she was about 15, 18 months that she had a developmental problem that turned out to be autism. And struggling to find out what are the treatments that are available, and it was quite amazing how little was out there, how little was known. I, as a physician, had no training in the understanding of the treatment of autism. So I just began to investigate, and fortunately had a series of good people that I was able to contact, and I became involved in a movement called the biomedical treatment for the care of autistic children, which has helped my child. And I still resisted doing this as part of my practice for a long time because of a bias I had about how proven these therapies were. However, over time, it became quite clear that there were thousands and thousands of children that were benefiting from these interventions. I continued to get involved in training and meetings, and saw some great effects, and decided to do this full time a couple of years ago. And I have a general family medicine practice, but I also have a substantial part of it is autistic children. Well, when parents come to me, they already have the diagnosis, because I don't make diagnoses. Mm-hmm. And they usually come because they might have heard of another kind of approach that has something to do with diet and vitamins, but they really don't understand what it's about. And what I like to do for them is sort of paint a picture of where this movement started and why it emphasizes and takes a different kind of a direction from traditional medicine. See, autism is defined in the psychiatric literature as a behavioral illness and as a developmental illness with certain behaviors that are associated with it. And it's got these behavioral characteristics, and if you meet a certain number of those characteristics, you get the diagnosis. And that is kept in the psychiatric literature called the DSM-4. That way to define autism began in the 40s when Dr. Connor first described autism. And then later in the 50s, Dr. Bedelheim, who did a terrible injustice to autism, was looking for causes and theorized, he was a big fan of Sigmund Freud, that it probably had something to do with the mother who didn't really love her child, and it was termed the refrigerator mom as the cause of autism, and that bias remained for many years. And it really wasn't until 1967 that Dr. Bernard Rimland wrote a centennial paper about describing how really autism was a neurological disease that probably had a genetic and certainly biological manifestations. And really he was responsible for this change in the paradigm away from pure behavior and pure psychiatry as a cause of autism and a treatment plan for autism into something which is more biological. Mm-hmm. and then some very good, he began the program called the Autism Research Institute, and that's where this whole idea of the biomedical interventions began. Well, you know, as the parents come in and they've just had this diagnosis, and I tell them that there's really another way of looking at autism, not just behaviorally, but what's going on in the body. And I say, look, you've been through extensive testing, and your child's met all these criteria. But isn't it more than a coincidence that every of the hundreds of kids that I see, almost everyone has a problem with their gut? They either have constipation or diarrhea or both. And that's 90% of the children that I see.
So something has to be going on.
So something has to be going on. I mean, it's not a coincidence. Now, it's not part of the psychiatric definition of autism, but I could tell you that it is not a coincidence. And these children, and the majority of them, and there's very good documented evidence for this, have food sensitivity issues. Now, the most common one is to gluten and casein containing foods, that is wheat and dairy. It doesn't mean that every child has that particular problem. But it is so impressive for more than half the kids, when you remove those specific foods, that it's really important to give that a try. And that means about 3 months to really give it a try and see if it helps. Now, there is some testing that you could do to see if there may be some other foods that the kids may be sensitive to. But what I do is I provide them with a diet that talks about gluten and casein free, but also very, very important that it is as pure a diet as possible. Dye-free, color-free, pesticide-free, as organic as possible, because I believe that all of those things that we've added to our diets, the way we've changed our diet, the way we worship corn syrup, the way we are inundated with advertisements about, you know, buy blue-colored cereal, and it's just incredible how our diet has changed. And I believe that that is an incremental, well, just an incredibly important part of why we see such a surge in these behavioral problems, and I think diet has a big place in that. So it's not just gluten-free, casein-free, and it's not necessarily going to help every single kid, but it has to do with really cleaning up the diet in general, and it certainly helps the majority of the children that I've seen, and the majority of children that are part of this network as well. And when you remove that, interestingly, you know, not just kids that are on the autism spectrum, but some children with hyperactivity, ADD or ADHD, they get better too. So it's really important. Digestive enzymes clearly are helpful, but you can't overwhelm the body with you know, these toxins and expect some digestive enzymes to overcome that. I mean, really, their role is that they're very helpful for helping to digest foods that you may be sensitive to.
Okay.
But if you have a big reaction to them, it's best to stay away from those foods.
Right.
Well, you know what I like to tell the parents as they come in, as sort of I continue with that conversation with them, is initially give them a little background about the biomedical approach, talking about the role of food, but really the overriding theme is detoxification. What I believe is wrong with these children biologically is that they have some kind of genetic predisposition, and then they encounter a series of environmental insults and manifest these aberrant behaviors as a result of these encounters and their predisposition. Now, those environmental insults are different for different kids. It's not any one thing. You know, it's not vaccines for every kid, or illnesses for every kid, or, you know, diet discretions for every kid. It's a series of things, and it has to do with how the body is able to remove things that are toxic to the body that we are all exposed to, but in these kids may accumulate, may affect their digestive tract, may cause inflammation in their gut, may therefore impair their immune system. And there's good documentation and good studies which show that they have an impaired immune system. And what we do in these biomedical interventions is try and help the body to essentially cleanse itself. First thing we do is we fix the gut, probiotics, digestive enzymes, diet, search for organisms that may overgrow, such as yeast, and treat that. And that helps the body's natural system for being able to detoxify. Well, it's unfortunate that there's dichotomy. There's this friction. This is not traditional medicine, and I understand that. And we don't have large randomized controlled trials to support this work. But I'd like to say that there are many incredibly bright physicians, PhDs, and researchers that are doing great studies. At this point, there are smaller clinical trials, but they're doing more research on these interventions and on the biomedical plan. And there's books that you can get. And another thing I do with these parents is I provide them with a list of books that I recommend that can explain the biomedical interventions and the evidence that we have that supports them. So I'd certainly like to see more of a conversation between the traditionalists and those that are pursuing the biomedical interventions, and I think we will in the future, but we just don't seem to be there right now. I encourage parents to pursue this as one of the things they can do that can potentially help their children, as I have done with my child, and I treat all the children the same way. The behavioral interventions are extremely helpful. There's great evidence that shows that applied behavioral analysis, ABA, is very helpful. But if you can couple that with a healthy diet and some of the biomedical interventions, you get better results. And I would encourage folks to do that. It is, because it is not recognized as a traditional medicine treatment, it is often ignored by insurance companies, denied. These interventions can be quite expensive. The food, when you're trying to put them on a special diet, can be expensive. I do have patients that write extensive letters and are able to get some of those food costs deferred as tax deductible. But vitamins and supplements that we use are often not, or never paid for by insurance companies. That makes it very difficult. I'd like to see more private sector contributions, help parents be able to try this treatment, because I think finances are a barrier, unfortunately, for a lot of them.